In another poster, we explored the persistence of immunity post-stem cell transplant in an era where we're using far more active agents against plasma cells, including both malignant and non-malignant plasma cells. Interestingly, the study came about because we saw, starting a couple of years ago, more and more information about outbreaks regarding measles in various communities in the United States, which is something we haven't seen in a long time. So a question came forward saying, what is the level of immunity that patients have post-stem cell transplant, particularly when patients receive very active induction regimens? So we tested that. We tested in a cohort of patients seen at the Mayo Clinic and for whom we had stored samples. And what we found, surprisingly, was that many of our patients have protective titers, and some of them, of course, lose it. But for the most part, they remain with some immunity. I was being pressed with a question, should we consider earlier vaccination? The measles vaccination is done usually until after 2 years from transplant. But what we find is that for the most part, individuals should be fine. And now this is just a preliminary study. We need to explore this further, but it should be reassuring for our patients as they consider what the implications might be for travel. Now, we, of course, did the study way before we even knew what was going to come with COVID, and people will have to explore a similar question. Perhaps by the next ASH meeting, we'll know that.